There's two key ways that someone will find out that they have been sexually betrayed. One is discovery. They discover a receipt, a sext, something on the computer. Someone tells them something. Or disclosure, where the person engaged in those behaviors humbly comes forward, or maybe they've been pressured to come forward, and have said, look, I need to talk to you, and they spill the beans with what's going on. Those are the two main ways. But what we know is that the majority, vast majority of people that have been sexually betrayed discover it. And yet, here's the irony, the cruel irony with this. Discovering it is the most traumatic way to learn about it. And yet that is what an addict fears most. One of the reasons why that's kept so secret is the shame of that secrecy and the belief that if this came out, the sky will fall. My life will hit black ice. No one will love me. She will leave for sure. And yet we know from the data that that's not the case. Some do, yes, but not all. We see that when there is discovery, there tends to be less trust and actually higher risk of divorce than when someone comes forward and discloses that. Because when he discloses, she has a greater basis of trust going into treatment than when she's had to find it and feel like he's been caught. It's really difficult to get that baseline of trust back. We have better outcomes that when there's a disclosure initiated by a husband, and when a husband owns the problem and openly shares what's going on. When we cut through the lies and get to the truth, that is enormously helpful and healing for both parties. 75% of disclosures, though, occur when a partner discovers some sort of evidence, right? The sex, the receipt. That's a high number. And so anyone that may be withholding information or a secret here today, my invitation is to really think carefully of how you could come clean and disclose that in a helpful way, maybe even with supports. If that feels like that is so overwhelming, there are ways, and I'm going to get to it in a minute, how we do that therapeutically with supports in place. So the way we do that with supports is what we call a therapeutic disclosure, a full disclosure. This is an honest and thorough accounting in writing of the sex history, the history of all the behaviors that have gone into the addiction, the hows, the whys, the frequencies. It gets into all the key events in one's life, traumas for the addict himself that may have laid the foundation for those behaviors to take root. It breaks my heart, the disproportionate number of male sex addicts who have been sexually traumatized themselves as young boys. And we need to give more light and attention to that piece, the trauma that they have occurred, and very often betrayal trauma for the men. We know that secrets of any kind fuel addiction, but they also create barriers to healing, and certainly intimacy going forward. So we know that to be able to reverse that, to introduce the healing concepts of healing, honesty, and the benefits of disclosure, it's not too late to introduce the benefits of that. And we can do that through a therapeutic disclosure where his therapist, her therapist, carefully negotiate and brainstorm the best way and time for that to occur. And again, that's where the testing and really being zoned into where is she at on that betrayal trauma spectrum, what's her skill set today on being able to ground and manage triggers and be able to receive that information in a helpful way. It's going to be painful, it's a difficult thing, but learning to time together. One thing I've really learned and become passionate about in this last 2 years is how important it is for a partner to feel included in that process. Okay, someone in the question for the Q&A later I know asked about what's the difference between when an addict shares their addiction story in 12-step versus a therapeutic disclosure. Well, one of the biggest differences is that she's included in this process. I have a 6-page handout of basically a menu of choices that I will give women, and I'll say, I want you to go through all of these choices, even if it takes weeks to get through it, and we can work on it together if we need, of what you want answered, What are the questions included in that disclosure that you most need resolution around? Where do you want it to take place? Do you want a polygraph as part of this process or not? We just go through every possible choice, and what we know is people that have been traumatized, if they're given a lot of choices in a helpful way, not an overwhelming way, when they feel empowered, it's incredibly healing for the trauma itself. So I want this to be a process that's helpful both for the addict and the spouse, that we work together in a collaborative way to produce an event, an intervention, that will be healing for both parties. Ideally, and there's wiggle room with this, of course, depending on where people are at, I want the addict to have a minimum of 90 days sobriety and for there to be some baseline safety established. If I have someone that's highly narcissistic, abusive, or a real pro at gaslighting, we may have to push that out until I can be confident that in the room, gaslighting and all of that minimizing and blame shifting will not occur. So it's not just, let's put this document together and share the truth with her. I hope you can get the sense and vision that there's a lot of very careful therapeutic planning going in to make sure this lands well and is an important turning point for a couple. If you go to the third point here, the APSATS has an ongoing survey that we've done with partners, and we know from that survey that 93% of partners were grateful that a therapeutic disclosure had occurred. That's a huge number. So basically all the people that had a disclosure found it painful but beneficial. And in a separate study that was just released a few months ago, of the people that had had a disclosure like this, 50% said it was one of the most healing interventions that they did in recovery. I know this is not as common here in Utah. In Colorado and also around the country, we're seeing a rise in the inclusion of polygraph testing prior to disclosure occurring. It's somewhat of a controversial topic. If I practiced in a fault state for divorce, I don't know if I would do it as often. But if we have a couple that's wanting to reconcile, in Colorado it's a no-fault state, as is Utah, as is Arizona. So the content from a polygraph has no legal weight unless there was something illegal that came out in that testing. But I can tell you I've seen phenomenal results when polygraph has been introduced. It's really been a game changer in recovery on so many levels. And it can be terrifying initially for the men. But when they get the idea that they're not a criminal, we're not treating it like that, we're treating it as a therapeutic resource, and we want this to be helpful for their recovery, they get to a depth of honesty and accountability that I just don't see being achieved consistently in other ways. So I just want to put that out there as an option, that there is a rise in that around the country. All the inpatient facilities are using it. My colleagues in LA, New York, Florida, and myself in Colorado are using this more and more. Some of the benefits, there's many, but one of the benefits that I see in a therapeutic disclosure is that it really can address some of the core fears a partner may have. If you look at this pie chart, they've surveyed, and this was 454 partners as of November 15. They said, what are your biggest fears going into a disclosure? What are you scared or even terrified of learning? 21% were scared about child pornography. 43% were scared about the possibility of an STD, being exposed to that. 18% were worried that their own children had been sexualized or objectified in some way. And 22% were most fearful of sex with same-sex sexual encounters by their spouse. So when we look at after the disclosure, this is one of the benefits, that it really sifts through worst case scenarios that were not based in what was actually happening. It can really settle a lot of fears, but it can also zoom in on some legitimate problems that need to be addressed in treatment. So after, 67% of women realized, I do have a legitimate reason to be fearful of STDs, because in the disclosure they very likely learned about unprotected sex or sex with other people during the disclosure process. And then the fear about sexualizing children went down from 18 to 7%. Sex with same-sex people went from 22 to 17, and child pornography from 21 to 9. So it's very beneficial for people to now know really what am I dealing with, and to have some fears be ruled out and just no longer in the mix.